training program, which is a 6-month course, which I have done from I work as an instructor in Vinayat College of Nursing in Sikkim. Then I work as a nurse tutor in West Bengal in observation nursing. Then after that, I went to Bihar from in Amanat project. This is also an NGO, which is called Care India. Then after that, in the year 2017, I joined in Japaigo. Under the Japaigo, I have worked in a various projects, family planning project, MCSP project, Manyata, and currently I'm working for a COVID. Family planning project,
we can't hear you. Hello? Hello, we can't hear you.
a minute, I'm connecting. Okay. Hello.
Yeah.
It's okay now. Yes. So, and I'm a member of Nursing Research Society of India, TNI, and SOMI. Workshop and conference I've presented in this 32nd ICM, this International Confederations of Midwife. In the year 2021, I have presented there and also done e-poster presentations in ICN, that's the International Congress of Nursing, in the same year, 2021. I'm a certified BLS trainer and also a certified qualified trainer from the Japaigo. I have written some blog, you can go to it, and some articles. And so that's it. So today we have a guest speaker. Jyotibala ma'am is there here with us. Ma'am is working as a lecturer in College of Nursing, Nigrim, Shillong. Ma'am has done her BSc from Nursing West Bengal Government of College in SSKM Hospital from Kolkata in the year 2001 and has completed her master's in the year 2007 from Nursing College, Christian's Medical College in Ludhiana, Punjab. She has done master's in maternal and child health nursing. When we are talking about her working experience, she has a working experience of 19 years. 3 years she has worked in a clinical area and 16 years she has worked in a teaching area. And she has done a lots of publications, like she has published 13 journals, has done a paper presentations almost 4, and even she has done a research project almost 14. She is also a member of TNI, SOMI, this Indian Associations of Neonatal Nurses and Clinical Research for Nursing Students. So thank you, ma'am, for joining with us. So I think without much delay, I'll just start today's sessions. My screen is visible?
Yes, visible.
Okay, thank you. Okay, so before starting my sessions, I request all the participants to switch on your video because I wanted to make the sessions as interactive as possible, because here we are not directly communicating, though I'm not giving the access for unmuting because again, lots of background noises will come, but yes, you can communicate with your chat box, okay? So today's topic is basic newborn resuscitations. In today's sessions, we are going to discuss about importance of performing a newborn resuscitations, what are the prerequisites or what are the different steps of newborn resuscitations, and what is the golden minutes, what are the things that you should do or you should not do during a newborn resuscitations, okay? So I think everyone has an idea about what is neonatal resuscitations. You can write in chat box. So as per your understanding, what do you mean by neonatal resuscitations? You can write in the chat box. Anyone? Okay, I have not seen a single response. You can, whatever you can understand, as per your understanding, you can mention. What do you understand by neonatal resuscitations? You can write in a chat box. Okay, revive. Thank you, Jenny. And if those who have submitted the pre-test, post-test, pre-test, no need to mention here, okay? Only if you need a pre-test link, ask that one. If you have already submitted, no need to mention, okay? Because I wanted to make the session interactive, so I'll just ask the questions in the chat box, you can answer. Okay, thank you, Diana. Emergency procedures when the neonate doesn't begin to breathe. Okay, thank you. Any others? Okay, basic life support. Okay, thank you for your response. So it is a set of interventions. Usually it is uses for this thing in order to assist the airway, breathing and circulations of a newborn after delivery. Okay, whatever interventions you are taking just to make clear the airway, start the breathing and the circulations of the baby, that is called the neonatal resuscitations. There are basic purpose of the aim of the neonatal resuscitations. Mainly, we will perform the neonatal resuscitations in order to prevent from the neonatal death. I think everybody know that one. And second most important thing is we wanted to prevent from the adverse long-term neurodevelopmental complications that usually associated with this perinatal asphyxia. Okay, so even what will happen usually if you'll start doing the newborn resuscitations little late, okay, then there is lots of chances that lots of damages will happen, especially in the brain, and we don't want to happen all those things. So in order to avoid that one, not only to save their life, but we wanted to prevent the long-term complications. So because of that, we will do the newborn resuscitations as fast as possible, okay, and correctly. Second things, let's talk about, let's ask about these things. How many of you, like here, we have almost 1,000 participants are here. So as per you, how many of you are confident enough to do the neonatal resuscitations? You can mention yes, or those who are not confident, you can mention no here in the chat box. No, yes, okay. No, yes, okay. Okay, no, yes. You can write in the chat box. Just I wanted to see your basic knowledge. Okay. Okay, no. Okay, so that means many of you have mentions here. Most of you are not much confident enough for doing the neonatal resuscitation. So that's fine. That's fine. Okay. So here I just wanted to show you some of the research study. In this research study, we just wanted to see, like, the nurses who are working in either in India or other part of the world. So I just wanted to see how many of they have a proper knowledge and skill about the neonatal resuscitations. When I find out some of the research study, so this is the one research study. I'm not going to say multiple research study, only here I'm going to show you one or two. Okay. So this research study this research study was conducted in Ethiopia. They have done for in order to assess the knowledge and skill of neonatal resuscitations of health professionals, especially in the University of the Teaching Hospital. And I have just mentioned the conclusion here. What they have concluded that the knowledge and the skill of the either midwife or the nurses or even the residents who are working in that University Teaching Hospital, their knowledge and skills are substandardized. That means that is not up to the mark. That's why there is a need of training for this neonatal resuscitations for all those health professionals. This is the one research study. Again, there is another research study. This research study was done in this maternity ward of non-governmental health institutions of Parsa district. This is our neighboring country. Like, this is the study of the Nepal, and they have conducted in the year of 2018. Actually, they have published this article in the year 2018. Okay, these are the few of the writers. And, what they have concluded is like, knowledge and skill. Here also, even in these hospitals also, they find they have a poor knowledge and skills. But what good things they have found is like those nurses who are already going for a multiple training, or those who are already giving care in maternity ward or already working in NSU and SNCU and all, they have good skill for performing the neonatal resuscitations. But the nurses who are working in other area, they have a poor. So that's why what this research study is suggesting is like, we need to do some kind of interventions, either continuing nursing educations or drills or training, anything you can do. But we have to do something so that we can increase their knowledge and skill. And this is the last study. This is done in India itself. They have done in tertiary care hospital. And this study they have done in 50 nurses. When they are taking the sample, most of them are under the 25 to 30 years of the age and below 5 years of experience. And most of them are this GNM qualifications they are holding. And 82% nurses, they have not gone through any neonatal resuscitations. Okay, and only 62% had experience of working in labor room. So what they have concluded here also, still majority of the nurses, they are having the average knowledge on neonatal resuscitations. So what I suggest is like, most of you have, even we saw a no in our chat boxes. It's okay. It's okay not to have a knowledge, but now we are a little bit aware that majority of us, we don't have knowledge and skill about the neonatal resuscitations. Now onwards, at least you can, you have the idea now, at least you can think about it. Especially, I just wanted to focus to those nurses who are working in a remote area, either in subcenter, PHC, where, there is not proper doctors or there is problems for handling the patients and all. At least if you learn the basic steps, you can save the child, okay? So these are the few research studies. So now, why we need to know about the newborn resuscitations? What will happen when we are doing a newborn resuscitations? As many of you have mentioned in the chat box also, that newborn resuscitations we are doing in order to revive or restore the breathing or the circulations or the airway of of the child. Okay, we wanted to bring back their life, and only 9 to 10% require a NBR. Here they are saying only 9 to 10%, but if 100 babies are getting delivered, that means at least 10 babies they require NBR. So that is also a huge amount. And if we know the proper technique of newborn resuscitations, 25% of neonatal death we can save. Okay, so it's in our hand. So if every year 100 babies are dying because of so many reasons, asphyxia or because of sepsis or so many other reasons, but if the 100 baby is dying because of birth asphyxia, that means these things, 100 babies are dying, that means 25 babies are dying only because of birth asphyxia. So that's why, being a health professional, we need to have a knowledge about the newborn resuscitations. Okay, so that's why we are conducting this class. So before starting, I think I gave the definitions and what are the purpose of neonatal resuscitations. So can you tell me what are the key to successful resuscitation? As per your idea or as per your knowledge, what are the things that you need to keep in mind, in order to make your resuscitation procedure successful? You can write in your chat box. Sorry, I'm not giving you a chance to talk, but I'll give you during the discussion time. But yes, you can write down in the chat box. What is the key things that you will do in order to make your resuscitation successful? Thank you. Proper positioning. Thank you, Nandini ma'am. Okay, PSR, sir. Correct size, mark size, proper marks, positioning, safety, environment, proper mark size. Okay. Thank you so much. It means, like, if I'm getting, you are answering the chat box, it means you are really participating in the sessions. Okay. Timely observation, skill, right technique. Many of you have mentioned the PSSR. Proper marks. Okay. Cover nose, mouth. Okay. Thank you. Right technique. Okay. So, yes. So, here, first thing is like, thank you for your response. First thing is like, you need to anticipate and start preparing. Okay, I'll ask you later when you need to start preparing for the NBR. But during the procedure, you can immediately call for help. Whenever you feel like, you are not able to handle by yourself, you can call for help. Okay, because if you are working in a team, work will be faster and it will be more effective way. And whatever procedures you are performing, it should be correctly done. Okay, if you are giving a wrong procedure, then again, if a single mistakes can again give another adverse. You need to document properly whatever you are doing, but whenever you are doing the procedures, you have to be very gentle and you need to provide warmth during the procedures. And most important things, do not compromise with the infections. Okay, because babies, as you know, it's newly born, their immune system is compromised, and if you are not using the proper infections technique, then again you are giving another problem to the baby. Okay, so that's why maintain infection prevention practices and hygiene. So these are the key to successful resuscitations. Thank you. I got so many response. Now, newborn resuscitations. So what are the things you will take care, before starting the newborn resuscitations? Or if you think that your baby is going to need for the neonatal resuscitations, what are the things you will keep ready in your hand just half an hour before? You can write in chat box. 1,000 participants are here almost. So, okay, you will keep ready. Marks, suction tubes, you'll keep ready. Okay, any others? Okay, embo bag, you will keep ready. Thank you. What are the different size of embo bag? You can mention here. Bag and masks. Okay, menu. Oxygen, radiant warmer, mask. Thank you. Oxygen cylinder, warmth, zero and one size. Thank you. 0 and 1. Other things. Okay, radiant warmer, intubation tray, laryngoscope, embo bag, ET tubes, gloves, embo bag, suctions. Okay. Okay. I think response is little less because here so many participants are there. I hope everybody is listening, because response is not as fast as I have that much of participant. Okay, emergency drugs, suction, distilled water. Okay. Thank you so much. Okay. That means most of the things you have covered, which I'm going to say. Okay, so already you have mentioned about the 0 and 1 size marks you'll keep. I'll show you. Okay, in the demonstration part, I'll show you this one. So embo bag will keep ready. Yes, oxygen cylinder with oxygen reservoir if you have, and then you will on the radiant warmer half an hour before. Okay, I think these all are the answers I got in your chat box only. Thank you so much. So when you will anticipate that baby is going to need for newborn resuscitations, how you will identify that this baby is going to have a for this baby you are going to do the newborn resuscitations. When you will start thinking what are the causes or what are the reasons which will make you think that this baby might need newborn resuscitations. You can write in chat box cyanosis, poor cry, no cry, mucinium stent. Thank you, gasping. Okay, okay, with no cry. Yes, ARDS, mucinium stent, cyanosis. Okay, fetal distress. I hope everybody is interacting. Okay, if the baby mother is post-stated, heart rate is less than 60, cyanosis. Thank you so much. Fetal distress, asphyxia, okay. Not crying baby. Okay, high risk mothers, liver distress. Okay, thank you so much. Thank you. Cry, cyanosis, fetal distress, low Apgar score. Thank you. History of mother with gestational diabetes, hypertension. Okay. Okay, yes. Yes. So I think here most of the point you have mentioned here. You have mentioned preterm birth. I think I have not seen this one. Born after a long traumatic labor also, and even after during at the late stage of delivery, when if you are using a sedation for the mother, that time also you need to be ready because baby might need NR. And even if the mother is eclectic, yes, you have mentioned somewhere here. And if the baby is born with tight loop of the cord or IUGR, or even if the mother is having a APH and all, okay, if the fetal distress and other points also you have mentioned in the group. Okay, thank you so much. Okay, thank you. Almost you have given a more point as compared to mine. So thank you so much. So these are the things. So if you found this any situations which is mentioned here, or if you feel like you the NR is needed, then you can start preparing for the procedures. Okay. So now here first what I'll do, I'll show you the demonstrations also, but briefly first I'll give you the theoretical knowledge of how to do the NBR. Then after that only I'll show you the demonstrations. Okay. So as soon as you will receive the baby, you have to receive the baby in a clean, dry, and warm towel. That's why we are switching on the radiant warmer half an hour before. And always we'll keep the baby on the mother's abdomen. And whenever you are keeping the positions, you have to keep in a prone position. I'll show you in the demonstrations. And always turn the face in one side. And during this time, you have to check for breathing. If the baby is fine, if the baby is breathing nicely, then you can continue with essential newborn care. Again, this essential newborn care topic we will take in the next class. Okay, tomorrow class is on this essential newborn care. So that's why I'm not going to explain in detail. But if your baby is not breathing, then immediately you have to call for help. Okay, and dry the baby as fast as possible. And during drying also, again, you can continue assessing the baby for the breathing. And still, if not breathing, then you have to quickly clamp the cord, cut the umbilical cord, and immediately shift the baby to the radiant warmer. Okay, and in the radiant warmer, if you have placed properly, then you can start your newborn resuscitations. Okay. So I think many of you have mentioned here PSSR. What is the full form of PSSR? Many of you have mentioned that we need to do the PSSR. Can you write down here in the chat box? What do you mean by PSSR? I'm not getting the response. Okay. Yes. Position, suction, stimulations, and reposition. Thank you, Emika. Okay. Position, suction, stimulation, and reposition. Yes. Okay. Yes. I think many of you have an idea what does this position, suction, and stimulations means. Okay. Thank you so much. So now here we are going to discuss these 4 steps only. Okay. So when we are talking about the positioning, I'll show you the demonstration also. Okay, you try to understand and I'll demonstrate also. So here in positioning, always keep the baby on the back and you need to place a towel. place a towel or the shoulder roller. We will suggest you to, in each of your unit, need to have a shoulder roller. Okay, keep the shoulder roller and place it under the shoulder. Okay, so many of you will sometimes get confused and they will put behind your neck, not behind the neck. Shoulder roller need to be put behind your shoulder, behind baby shoulders, and we will try to keep the baby positions in sleeping positions. Okay, it should not be too extended, or it should not be, the positions have to be correct so that airway should be in a straight line. Okay. Okay, and wait a minute. So this is the positions here we have given in the pictures also. I think everybody able to see the pictures. Second, we will do the suctioning. Suctionings, I think suctionings I have mentioned here also, and even in pre-test also, I think I have asked you suctionings whether you will do mouth first or nose first. So whenever we are doing a suctioning, always mouth will come first. Okay, even if you will see the alphabetical letters also, M will always come first, then N. Okay, so start your suctioning from the mouth and then only we will go to nose. You can use either a mucus extractor or you can use a suction machine. Okay, it's up to you. But whenever you are inserting the tube, you have to be very much careful. If you are inserting, if you are using the tube in the mouth, you should not insert more than 5 centimeters. Okay, and in the nose only 1 to 2 centimeters. Why we are not inserting more? Because what will happen sometime? Posterior pharynx, if you will stimulate the posterior pharynx, that time what will happen? The baby will have a vagal responses. And in that cases, baby will either have a bradycardia or apnea. So here you are going to, you are helping the baby to, regain their breathing and circulations. But if you are not doing correctly, as I mentioned you before, then again you are giving another problem. Okay, so that's why you have to be very much careful. Third one is stimulations. Stimulations, we will not rock too much. Okay, you have to be just halka, gently. You just give the flickering in the feet. I've shown the pictures here also. Okay, or you can do a slight rub at the back of the baby. Okay, if you do more, then what will happen? Don't stimulate in that much. Okay, because their skin is very fragile. If you don't more concentrate on reviving the baby, you also take care of all those things. Okay, so you have to be very much careful. And after that, again we'll come to the repositioning. Okay, like the before one. And once you have completed this PSSR, now you have to select the size of the your ambo bag appropriately. Okay, if the baby is a preterm, so which marks you will use? You can write in the chat box. If the baby is preterm, which marks you will use? 0, 0, 0, yes, thank you. 0, 0, okay. Okay, thank you. So yes, so that's why you have to choose the marks correctly. Because I think you have seen in the pictures also here. We wanted to cover only the nose, okay, and nose, mouth, and then little bit of the chin. This is the incorrect one. See this one. This is the incorrect one, and this is the correct one. We are covering the nose, mouth, and little bit of the chins, okay? So that you can give proper amount of ventilations. So this is there. Then after putting, then we'll give a 5 ventilatory support, and during that you can check the chest rise, okay? And this thing during the initial stage ventilations, when you are giving, rate should be 40 to 60 breaths per minute. Even I have asked these questions also in pre-test. I think you got the answer. Okay. And how you can maintain this rhythm? Either you can, when you are squeezing the back, you can say breathe. And after when you are releasing, you can say 2, 3. I'll show you the demonstration also. Okay. So in that way, if you are saying a squeeze 2, 3, squeeze 2, 3, if you'll do in that rhythm, then at least you will be able to maintain 40 to 60 breaths per minute. You have to see, okay, when you are placing the bag and marks, and when you are giving a ventilatory support. So when you are checking, that time baby's chest need to be raised. What will happen if the chest rise is not there? That means sufficient amount of air is not going inside the baby body. Okay, it may be because of so many reasons. Either if air is got blocked, or you are not giving a sufficient pressures, or either your position is not correct. So you can check. Unless and until if you will not see chest rise, then don't continue with your ventilation. Don't continue with your mechanical ventilation. Continue with your resuscitations. Okay. So assess the breathings again for 30 seconds. And for 30 seconds, we will continue. So here, see, I told you like golden minutes, okay? So 30 seconds we are taking in the first sessions. When you are drying, suctioning, and doing all those things, we will spend a 30 seconds. Then 30 seconds you will entirely dedicate for the bag and mask ventilations, okay? And after 30 seconds, if the baby is not breathing, then you can call for help and continue for the 30 seconds, okay? And after the 30 seconds, you can check for the heart rate. When you are checking for the heart rate, okay, assess for 6 seconds. And once you will assess for 6 seconds, you can multiply into 10, okay? For example, after 30 seconds of bag and mask ventilations, I assessed umbilical cord and I found only 5. That means 5 into 10, 50. So I will not, I have to continue because it's less than 100. Okay. You will continue till the baby will have more than 100. If baby will have less than 100, or if the baby is not breathing, then you have to continue with the bag and mask ventilations. But additional what you can do is here now you can connect with the oxygens. You can give a 5 liter per minute as per, or you can give as per the doctor advice. Then you continue till your teams who is doing for this advanced life support care and all, or till the doctors will not come, you will continue doing the mechanical ventilations. Okay. And if the baby is more than breathing, or if heart rate is more than 100, then you can place the baby in a observations care. In observations care, usually what things we will do? In observations care, what are the things you will do in observational care? Okay, monitoring breathings, checking vitals. Okay, breathing, vitals. Okay, other than vitals and other than vital signs. Okay, maintaining warmth. Thank you so much. Heart rate colors. Okay. Okay, breathing, heart rate. Okay, exclusive breastfeeding started. Check for crying, check for saturations, skin to skin care. Thank you. Thank you. So observations care here, you have mentioned in the chat box. Okay, you can read also. Keep the patient's baby in between the breast, in the prone positions, cover the baby and the mothers, provide warmth, start breastfeeding and monitor the vital signs every after 30 minutes. These questions also I have asked in pre-test. Okay. So this is there. And what you should not do during a newborn resuscitations is like, do not do the routine aspirations. Do not do the postprandial drainage. Do not squeeze the chest of the baby. Okay. And in some hospital, I have seen like, they are doing a routine suctions. Even if the baby is crying, they used to do the suctions. No need to do a routine suctions. Okay. Do not use any kind of injections like sodium bicarbonate and all. Do not slap baby. Do not overstimulate the baby. So these are the things that you should not do during a newborn resuscitations. I think you got a pretty much clear idea about the this thing. Newborn resuscitations. I'll do the demonstrations first. Then we'll start the discussions. Okay. If by the time if you have any doubt, you can write in the chat box now. Now also you can write it down. I'll show you the demonstrations. Okay, give us a few more minutes. And still, I'm seeing some of the participants are connecting with the passcode. Please rename your device. Otherwise, later you are again messaging me, ma'am, I got only this much attendance and all. Okay. Give us few minutes. I'll try to stop the demonstrations. Rename your device. Okay. Down. Yeah. It's little audible. Of course, we see. Am I audible?
Yes.
Okay. So now I'll show you the demonstration. First, what I said. Actually, we are not doing the delivery route. Only we are saying. I think, and I will try to show you as much as possible. Okay. So this is the delivery. Okay. As soon as you will deliver the baby, we will place the baby on the mother abdomen. And as I mentioned you, when you are placing the baby on the mother abdomen, you have to place the baby in a prone position. But do not forget, okay, keep the baby face on one side, as I told you. Okay, keep it one side. And then during this time also you can check whether baby is breathing or not. You can see, whether baby is crying or not. Okay, if the baby is not crying, if the baby is crying, if the baby is okay, then no need to do this. You can continue with the essential newborn care. As I mentioned, we will explain you in our tomorrow sessions. So, but if the baby is not breathing, then what we will do? We will immediately cord the clamp. We will immediately clamp the cord, cut it down, and then we will, anyway, we are drying here only. So we will dry, and whenever you are drying also start from the head, and then same clothes don't drag down, okay? You can use the clothes whichever is near to their extremities. We can dry, then you can take the baby to the radiant warmer, okay? Okay, so now this is the radiant warmer. This is the radiant warmer. Imagine, okay. You can place the baby in the radiant warmer. So as soon as you place the baby radiant water, what are the 4 steps? Positioning, suction, and stimulation. So I'm positioning the baby. So when I'm positioning the baby, I'm keeping the shoulder roller just under the shoulders. I think it's visible. Okay. It should not be under the neck, as I'm repeating you. I have done the positioning. Now I will do with the suctioning. Okay. Either you can use a manual suctions or you can use a mucus extractor. Whichever is available in your facility, you can use that one. When you are doing the suctioning, how much length I have to put if I have to insert in the mouth? How much centimeter I have to put inside baby's mouth? You can write in the chat box. I can see. Chat box, this one. Right? Okay, thank you. So we will, as I mentioned you, we will start the suctioning from the mouth. So we will insert a 5 centimeter. And while doing the suctioning in the mouth, as I mentioned, you don't go more than 5 centimeter. We don't want to stimulate the posterior pharynx. Okay. Then we will suction nostrils one by one. I think you have to suction the nostrils one by one. Okay. And here in the nostrils, how much centimeter you will insert? 1 to 2 centimeters. Okay. Thank you. Still who is writing 2 to 3 centimeters? Your prostist will wrong it. Okay. 1 to 2 centimeters. Okay. You have to do this one. And if you are doing with this using pressures, when you are using the suction pressures, it should not be more than 100 millimeters of mercury. Okay. So I have done the suctioning. I have done the positioning and suction. Now third steps is, what is the third steps? Third steps is, you can write down in the chat box. Okay, so it's the third steps is the stimulations. And when you are doing when I told about the stimulations, you can either do a halka, a flickering in the, or like slight slap in the feet of the baby, or rub the back of the baby. Okay, 1 or 2 times. Don't do the overstimulation. And when you are moving the baby, when I'm moving the baby like this, what will happen? Your position is, see the baby position. Okay, it has also changed. So again, that's why we wanted to reposition the baby. Okay, so I have completed with the PSSR. So I have completed the 30 second. Now I'll move to the and go back. Bag and marks ventilations. Okay, so these bag and marks ventilations you have to check before only. I have both the marks. Okay, so in your trays always keep both the marks. So I have both the marks. So this is a term baby. So I'm using a 1. I'm using a 1. And when you are connecting this marks and bag, you have to place your thumb. You have to place your thumb inside your marks and then insert like this, okay, so that it will be tight. And I think everybody know how to check whether your embo bag is functioning properly or not. What are the things you will check in embo bag, whether it's okay or not? How you will check? Okay, fish mouth, whether it's open or not. Interlock, thank you so much. Valve you will check. Pop sound you will check, and send inflating. Thank you so much. And leakage. Okay, so thank you so much. So how you are checking whether it's a leakage or not, you can place in the hand and then you can press. Okay. During that time, I think you are able to hear the sound. That soft sound is there. Okay. This sound should come up and this should it should be moved. Okay. What will happen otherwise if it's not moved? What will happen? For example, if you are cooking your rice in rice cooker, and if this rice cooker whistles will not come up, what will happen? It will get burst. So here also, what is the purpose of using this one is like safety valve is like we don't want to give more air inside baby lungs. We don't want to rupture baby lungs. Okay, so that's why even if you are pressing a mode, that excess air, we wanted to remove it. So that's why this valve have to be moved and then it should be functional. Okay, and I think I don't know whether you will able to see or not. Fish mouth is, it will be here. Okay, I think it's okay. I think, yeah, I think everybody knows. So here you need to check that fish mouth is there or not. Okay, so this is working. So now I have to place the baby, place the embo bag in the baby's mouth. When you are placing, you have to keep the C and the E positions. Okay, so when I'm placing the C position means in the marks, the upper region is the hard one. Okay, this upper part is the hard one. So I'll place my this thumb and then index finger here, and I'll make as a C. Then this three finger I will use to open the airway. Okay, this middle finger I'll use just to lift the chin, and these two finger I'll just use to support the chin of the baby. Okay, so that so in that way it will be C and E positions. Okay, I don't know whether you'll able to see, but I'm trying my best. Okay, so C and E positions. Once I'll maintain the C and E positions, as I told you, I'll give the 5 ventilatory support. 1, 2, 3, 5 ventilatory support. Why I'm giving this one? Because I wanted to see the chest rise. I don't know whether you'll able to see or not. So if there is a chest rise, okay, so there is a slight chest rise. So if there is a chest rise, then I will continue with the 30-second bag and marks ventilations. I'll continue during a squeeze time. I'll say breathe 2, 3. Okay, breathe 2, 3, breathe 2, 3. So that's why in your unit you need to have a second wala watch. Okay, so I'll continue for 30 seconds. Breathe 2, 3, breathe 2, 3, breathe 2, 3. After that, again I'll check for the breathing or the heart rate. If the baby is not breathing or if there is no heart rate, then what will I'll call for the help. If you have other people to help you, it's well and good. Okay, if you don't have, you can call for the help and you continue. Okay, you continue for the 30 seconds. Once you will continue with the 30 seconds, after that you can check the heart rate. How you are checking the heart rate? Either you can use a step, okay, or especially the baby we will check in the umbilical cord. I think everybody know we will not use the thumb. So use in the umbilical cord, check for the pulse. We will check only for how long? How long we will check? 1, 2, 3, 4, how long second? 6 seconds. Thank you. That means you all are attentive in the class. Thank you. So we will check for the 6 seconds. Okay. And then we will multiply. For example, I got 7. That means, what is my heart rate? I got 7 now. What is my heart rate? You can write. Okay, 70. Thank you. So that means I will continue or I will stop. I will continue the bag and marks ventilation or I will stop. Continue. Thank you so much. Because we will continue unless and until baby's heart rate is not more than 100, we will continue. Okay, if it's less than 100, we will continue. If it's more than 100, then we will stop. You can stop. Okay, if that means if baby heart rate is 100 or if baby is breathing, then you can stop. But if the baby is not breathing, heart rate is still you are getting 80, Then we will connect with the oxygens. Okay. So here I think in embobac only, I think most of you have seen there is a oxygen inlet is there. Connect with oxygen inlet, connect with oxygen source, either with the central line cylinder, whatever. Okay. Then again continue with the bag and mask ventilation. Still your team will come who will give the advanced life support. Only I am going to take the pediatric life support class, and we will also have this advanced life support class. In that, we will discuss detail about the others techniques, okay? But here we are only dealing about the newborn resuscitations. So we will continue till our team will come. And once the team will come, then we will continue with the advanced life support. That class we will take later. Okay, and yes, there is a slight changes in PSSR nowadays, but it's only in the guideline. Nobody has started implementing. That's why I have not changed in PPT also. So in PSSR, before we are saying PSSR, liposuction, suction, stimulation, and reposition. But now they are saying a positioning, clear the airway, dry the baby, then do the tactile stimulations. They are changing slight changes is there. But I think nobody has started implementing, so that's why I have not changed in slide also. Okay, so I think I have not missed anything. So now you can write down your queries. By the time I request Jyotimela ma'am to add your points in this topic. Okay, and by the time you can write down your queries here. And with the computer audio. Yes, I will disconnect with the. Can we disconnect this?
Good afternoon or good evening to everyone. Okay. It is a very nice sessions what Nanuka has already taken up. And one way it is a very interesting topic that newborn resuscitation is very much required to have a knowledge by the nursing professional who are dealing mainly with the newborn babies. So whatever the point that Nanuka madam has already discussed, that is a very important point. What we, the nursing professional, what I want to add in this one is that we have to reduce the neonatal mortality and morbidity of India. So basically, we have seen that in order to reduce the newborn mortality and morbidity, what we have to do is we have to develop the skill. People who are working in the newborn area, that is in the labor room area or in the NICU or in the sick intensive care unit, this skill need to be trained to update ourselves. So this is a very good interaction. I can see that all the participants are giving an active response when Nanuka was asking each and every questions, each and every step when she was explaining about it. The point here is when a person is dealing with a newborn, right at the time of the delivery, that golden minute is very important for the life of a baby. That comes in the hand of a nurses. So the golden minute should be remembered by all of us who are dealing with the newborn babies in the delivery room area. Usually it has been seen that a normal newborn baby which has been born does not require that much of resuscitation, just an essential newborn care is required until and unless a baby is being developed with the asphyxia. So she has already said that if it is expected or any meconium stain aspiration is there, what we have to do is that golden minute chance should not be, should not be wasted. It relies all on in the hand of the nursing person who is handling the baby. So every step she has already explained in it. I hope everybody has understood and you people are working in the same field. If anything question is there, we can have a discussion.
I think, am I audible? Yes, I have seen someone have asked why we are not doing nose first, why we are choosing the mouth first. What will happen? No? For example, if you are eating, if your mouth is full of rice, for example, we all are Northeast here, so I think everybody eat more rice. So if your mouth is full of rice, and if at the same time you feel sneeze, what will happen? Okay, so it seemed like with the baby also. For example, if the baby's airway is full of secretions, if the mucus is there, and suddenly if you are, stimulating the nostrils, and if baby will sneeze, then what will happen? Then again, there is a chances of aspiration. So that's why we don't want that one, because in buccal area, so many secretions will be there. So that's why we don't want to have that one. So that's why always we clean the mouth first, and then we'll go the nose. Yes. So another question is asked, what should be done if the baby heart rate is more than 100 beats per minute, but the baby is still gasping? SpO2, 94 to 97. Ma'am, you want to answer this, sir?
I'll connect. What was the question? That one? Okay, what should be done if the baby heart rate is more than 100 beats per minute, but the baby is still gasping? SpO2 is 94 to 97%. Okay, that time what happened is we, the nurses, should continue with our resuscitation, but we should call immediately, promptly the pediatricians who are available out there so that necessary action can be done immediately. Yes, right. We have reached to a target of 100 beats per minute, but still the baby is gasping. Means somewhere or the other, we have to rule out what is the problem behind. So by that time, still we'll continue our nursing resuscitation of the newborn, but we need a pediatrician to give a suggestion on it.
Thank you, ma'am. Okay.
Any question?
Yes, thank you so much. There is another question is also asked by Elizabeth, like sometimes baby conditions is good, but after some time it start deteriorating, like grunting, cyanosis, and what could be the reasons? You want to answer? Actually, for the reasons for the cyanosis and grunting, maybe there are many reasons for that one. Okay, so you need to identify whether it's related to mothers or related to babies. You just try to identify the reasons, and as per the causes, we will deal with it. Okay. Okay. It's okay. So that is there. Any other questions you want to ask? Okay.
So what's the question?
Questions, let's see. We have to sit together. I think I have seen few questions here. Okay, we are trying to find out your questions. Okay. Okay. Hello. How many times we have to squeeze the embo bag to see the chest rise? 5 times. As I
Yes.
told you, 5 ventilatory support, this thing support you can do. Okay, 5 times you can squeeze the embo bag and you can see if there is a chest rise. Then you continue. If there is no chest rise, then again see for the positioning. You can see, check for the clear the airway and all. You can do it. Okay, so that is there. I think any other questions can you scroll? How many cycle in 1 minute? How many cycle in 1 minute? How many cycles in 1 minute? Like you are doing a 30-second, no? Like 30 second you are doing. 30 second you are doing, and then you are giving a these things. You are giving a rescue breath. Okay. So after the 30 means what's coming? It's coming at 3. Sometimes 3 to 5 cycles, it will come in 1 minute. Yes. Any questions? Okay, down. Any other queries you want to ask? Anybody, if you wanted to share,
yeah, the suction pressure. That
because of the thank you and post is submitted queries, we are not able to read your questions. Thank you, those who have submitted your posters. Thank you. No need to write. We are trying to catch these things. Read the questions, but it. Can you please repeat what is the suction pressure? 100. It should not be more than 100 millimeters of mercury. I think you got the answer. What happens if we insert the suction tube in the nostrils? More than. It's okay. No, it's because of the response. These things. I think okay. Because of your thank you response. Thank you so much. Certificate I'll give you after entire sessions. When we can stop resuscitations? When the heart rate is more than 100 beats per minute, and when the baby is breathing, then you can stop doing newborn resuscitations. Procedures one more time. Okay, in procedures, first we will receive the baby. We receive the baby in mother's abdomen. Okay, dry. Receive in a clean, this in warm towel, and check for the place on top of the mother's abdomen and see. Okay, if baby is breathing, then continue with the essential newborn care. If the baby is not breathing, then place the baby in radiant warmer. Then continue with the PSSR, positioning, suction, stimulations, and repositioning. And after that, give place the embo bag. During this PSSR also, if the baby is not breathing, then you can continue with the embo bag and masks.
Related to that golden minute, what she has said, that baby should be kept in the abdomen. That time you have to assess the 5 point, which we mentioned in the some of the participants have mentioned about the Apgar score. That Apgar score is very important during that time period when the baby is kept in the mother's abdomen. So we have to have us 5 criteria. So each criteria should be given of 12 seconds to assess it in order to see whether the baby is stable or not. In case if the baby is not responding it, we will need to cut the umbilical cord, as Nanuka has said that. So please keep in mind that you maintain, you see the word Apgar score within that 5 points while receiving the baby in the mother's abdomen. That is very important to keep in mind.
Okay, thank you, ma'am. So there is another question. Sometimes feeble heart rate and can be heard during the auscultation, but breathing is not there. What should we do? We will continue with the resuscitations. We will continue. And in these recent guidelines, I will share you the recent guideline also. They have mentioned there, if the breathing is not there, you can give the oxygens. Okay, and connect with the pulse oximeter so that you will check the saturation level of the baby. And as per that one, you can give the oxygens and continue with the newborn resuscitations. Okay. I think what is the preterm baby suction pressures? Preterm baby suction pressure, that I don't have any idea. Anybody have any idea? Preterm baby suction pressures. You have. I will find out and I'll message you in the WhatsApp group. Okay. If anybody have an idea, you can write down in the chat box. How much pressure you will use during suctions when you are dealing with a preterm baby? If anybody have answer also, you can write down in the chat box. I think everybody post-test we have given.
And somebody has asked about the complications of the post resuscitations. What happened is sometimes we are doing the resuscitation in the improper way, or the suction has been done in such a way that it injures the mucous membrane. And while doing the embo suctioning, what happens? More pressure has been given, the lungs can be burst it out. So we should be very careful while doing the emboing. That is the main thing. That lungs is the main part which is being affected during the resuscitations part.
Okay. So another question is like, after one cycle, heart rate for how many seconds? I think this same question I have asked you also in pretest also. 6 seconds you can check, because we don't want to waste more time. You check for the 6 seconds, then multiply into 10. Okay, then you'll give the rough idea. During observations time, as soon as you'll give the baby to the mothers, then after 30 minutes, you can check for the vital signs. Check every 30 minutes, at least for 2 hours, okay? Thickness of the towel rolls is like usually they say 1 to 2 inch. In hospital, sometimes we used to say the size of the 2 rupees coin is there, no? That much thickness you can use. What are the complications of neonatal resuscitations? So it depends. If you are doing a delay neonatal resuscitation, there is so many neurodevelopmental complication is there, which I told you during the initial period of my class. Thank you for those who have submitted post-test. Okay. Please submit all the pre-test post-test. I think I'm not seeing more questions. Any questions? Pressure 100, yes. I think this much. I think there is not much questions. WhatsApp group, yes. I have created a mini WhatsApp group is there. Okay, so you can join in the WhatsApp group. If your friends is there, you send me a number or I'll send you the link. I'll send you the link